So today we have Dr. Tejas Shah with us, who is presently working at Krsnaa Diagnostic Limited, Pune, as a consultant and head in the Department of Molecular Diagnostics. He has completed his PhD in biomedical sciences with specialization in molecular pharmacology and immunology. And he has done MBA Operations and Management from IMS Mumbai. He has worked on several prestigious projects funded by ICMR, DST, Department of Ayush, and has published more than 20 international publications, three book chapters having more than 250 plus citations. He has interest and expertise in NGS, microarray, flow cytometry, and allied molecular assays. He has also worked as task force member on repurposing of drugs for COVID, which was funded by DSIR, Government of India. So thank you, Dr. Tejas, for joining us today.
Hello. Good
Hi.
afternoon, Dr. Manisha.
Yeah, hi. So,
Yeah,
Dr. Tejas, can you share your views on what are the key advantages of next generation sequencing, NGS technology in cancer research, and how has it transformed our understanding of the genetic basis of cancer?
yeah. So as genomic, focused pharmacology, or we call it as personalized medicine or precision medicine, at least in cancer, has played a greater role in cancer treatment basically. And NGS has emerged as a valuable methodology for obtaining deeper and more accurate, molecular underpinnings of individual tumor. See, what happens in cancer treatment is, we either go with chemotherapy, radiation, surgery, and more recently immunotherapy. But however, the same treatment for different patients might, respond differently. And this difference is due to heterogeneity among the, tumors or inherent genetic variations between the humans, and also the evolving genetic variations between cancer types. And NGS helps us to, account this and give us the precise medicine. When I say precise medicine, it's the right therapeutics to the right person at right time and at right dose also. So this is how NGS helps us while giving any kind of a treatment towards any kind of a patient or cancer patient. And compared to traditional methods, NGS offers us accuracy, sensitivity, speed that has potential to make a significant impact. Because we can study multiple genes ranging from 5, 10, 50 up to 500 genes, within that of 7 days, within that of 7 days, work with the NGS as such.
Right, right. So that is what we call multi-gene testing, right?
Right.
So my next question is that how is NGS technology guiding clinicians to take cancer treatment decisions, and what role does genomic profiling play in personalized medicine for cancer patients?
Uh, so NGS has the potential to change the future of oncology, very frankly. In fact, per se, I would say NGS has already revolutionized the future of oncology. Like comprehensive genomic profiling has an ability to enhance clinical decision making and personalize innovation treatment for individual patients. By providing oncologists with comprehensive molecular characterization, that is a best part of utilizing any kind of a molecular technique or NGS while treating the patient. So that's one more thing. And apart from this thing, NGS can be utilized for diagnosis. Tumor subtypes that only few years ago we used to check using microscope. Morphological criteria, but today the criteria has changed from morphology, or I would say morphology plus genetic variations gives you a better criteria. This is one thing. Second is the finding an appropriate targeted therapy, as an increasing number of therapies have indicated based on nucleic acid, be it be DNA, RNA sequencing results. Like, and just an example is trastuzumab. Doctors recommend in case of HER2 inhibition or in case ERBB2 amplification is seen. So, but for that you should have a genomic kundli, I would say,
Yeah.
that NGS gives us. Yeah, that's the plus point of NGS. And then the third point can be clinicians stand to benefit from NGS. When a patient stops responding to a particular targeted therapy, we call this at resistance, mutation resistance. For instance, we see it in EGFR mutations while treating NSCLCs. So continuous monitoring of EGFR gene is required in case he was positive for that. So that's an add-on benefit if you utilize NGS, in any kind of a treatment.
Right, right. So I like the word kundli because that's what it's doing. So, what is the significance of germline analysis using NGS in assessing cancer risk?
Yeah. Uh, Sorry, I missed your question. Again, there was some disturbance, ma'am.
That's okay. So, what is the significance of germline analysis using NGS in assessing cancer risk? So, germline analysis, is it important nowadays?
Germline analysis. Right. So germline mutations are also, we call it as hereditary mutations because they are passed from parents to offspring. Inherited germline mutations also play an important role in cancer risk and susceptibility.
Yeah.
It can be cancer risk as well as many other diseases also, not only cancer. We call it as rare disease also. So in the era of precision medicine, I feel genomic integration for identification of both germline as well as somatic alteration has become increasingly important. Clinical genetic testing to diagnose germline mutations often requires blood or saliva smear from cancer affected individuals basically. And the rules for testing in families when cancer affected individuals are deceased previously, while such germline testing is usually undertaken by a phenotypic driven single gene approach. With the advent of NGS technologies, the widespread utilization of multiple gene or multi-gene panels, has been proven beneficial. And the concept of precision, cancer prevention, like we say for somatic, it is precision medicine, but here I would say precision prevention in germline. If we go for a risk assessment analysis using NGS, particularly for inherited cancer like HBOC, hereditary breast ovarian cancer, or Lynch syndrome like cancers.
Exactly. Correct. So, here it is prevention. So, how does
Yes.
NGS facilitate the analysis of somatic mutation now in the cancer tissue?
So basically, somatic mutations have been, known to cause cancer, and more recently have been implicated in variety of non-cancerous diseases as well. The pattern of somatic mutation or mutational signatures, I would say, also shed light on the underlying mechanism of mutational process, and
There's some
thereby increasing these unique somatic mutations. Right. So comprehensive tumor and blood profiles can help us to identify biomarkers that are prognostic or predictive in nature.
yeah.
Again, coming back to somatic, somatic mutation in oncogenes and tumor suppressor genes are major cause of cancer. And somatic mutation analysis is crucial for genomic approach since it can, identify driver mutations. I would say it as, the Achilles of heel. It is the weak point, driver mutation of any cancer, and support clinical decision making through the KIT mutations, which are present in almost 50 to 70% of gastrointestinal stromal tumors, or EGFR in NSCLCs, almost 15 to 20% of NSCLCs. And then lung and colorectal cancers do have KRAS oncogenes, so they are well established mutational signatures. And once we study this kind of a tissue biopsy or somatic kind of mutations in cancer tissues, it helps us to guide any kind of a appropriate chemotherapy regime. This is what I feel, how NGS
Yeah, definitely. It helps us in finding out the driver.
facilitates analysis of somatic mutation.
Exactly.
Right, right.
Right. So my last question is, what is the role of liquid biopsy, powered by, of course, NGS, in monitoring cancer progression and treatment response?
So yeah, in last a decade, liquid biopsy has really got a it has catched a good momentum, I feel. And liquid biopsy is nothing but it's very simple, a prick in your hand, and you just get a blood, peripheral venous blood, for any kind of analysis. So it can be other than blood, it can be saliva, it can be CSF fluid, it can be any pleural fluid as well. And it has a broad applications in oncology as well as reproductive biology, cardiovascular diseases, immunological diseases. As good as non-invasive prenatal testing, what we do in reproductive biology is nothing but we just take a blood from the pregnant female and we analyze that. That's a best part of a liquid biopsy. Without or I would say a minimal or non-invasive detection of circulating tumor-derived components in biofluids, such as blood, and it has a revolutionary approach with significant potential for the management of cancer, because it has got multiple circulating tumor DNA, total nucleic acid, cell-free DNA, exomes. So that helps us to identify, what has gone wrong in that particular patient in terms of molecular, signatures or mutational signatures. What kind of a treatment should be, imparted on that particular patient in case there are, reorientation treatment strategies we need to decide in timely manner. That all things can be achievable using liquid biopsy. So problem with tissue is, genotyping of tissue has a inherent limitation. Basically, it represents a single snapshot in a time. Once you take the tissue, you go for NGS, and then there is nothing progressive we can check in that. But with liquid biopsy, you can monitor it in a timely manner. That's the best part. And with single cell genomics, which has again come in last couple of years, spatial selection bias owing to tumor heterogeneity can also be studied with liquid biopsy.
So that's what I know, that it's real time, it's progressive, and it helps in monitoring, definitely. So
Right, right.
thank you so much, Dr. Tejas.
Thank,
This was really insightful and a valuable information for us.
thank
Thank
you. Thank you very much.